Hello everyone, this is Dr. Langdon, board certified pediatrician, mom of 6 and grandmother to 3 with an updated version of my hand, foot, and mouth video. I had done a brief one before, but this will have some more details as I've continued to receive some after hours questions from parents. We in North Carolina have been seeing a lot of hand, foot, and mouth disease in the clinic. Hand, foot, and mouth disease is a virus that's caused usually in the United States by a virus called Coxsackie A16, but is also caused by other viruses and other places such as enterovirus. It presents in kids who are often a little cranky, decreased appetite, sometimes fever, and a characteristic rash on the palms of the hands, the soles of the feet, around the mouth on the outside, sometimes with lesions inside their mouth, and often a characteristic diaper rash as well. The sores all look very similar. They're sometimes slightly oval, reddish areas with fluid or the vesicles inside those little sores. They can be very tender. I have seen children before that had so many lesions on the bottom of their feet, they could not even bear weight. It was too tender to walk on them. Our biggest concern, as you can imagine, is if they have sores around their mouth. Sometimes in the younger ones, that's enough to make them not want to take their bottle. But especially at any age, if they have sores inside their mouth, it can be very painful for them to drink fluids or eat solid foods. So they may refuse to do so and then are at increased risk for dehydration. You know, with so many different things we talk about on here, I want you guys to monitor their urine output. So in little babies, that's easier. They need to have at least 3 pee diapers every 24 hours or 1 urine output every 8 hours. But for older kids, you can just ask them, hey, have you gone potty lately? You can look inside their mouth and make sure it looks moist and that they're making saliva, or if they're crying, they're making tears, things like that. But the urine output's probably the very best thing to monitor so that you have a clear idea that they're not dehydrated. Another question is fever. Can hand, foot, and mouth cause fever? Absolutely. Now, you know, as always, if we're talking about a tiny newborn or infant, fever is not okay. But other than that, once we're in the older infants, the toddlers, school-age kids, adolescents, adults, the fever is okay. And it's the body responding against this virus or any virus. And the fever is just a part of our natural response, our immune response. And it's honestly sort of a marker that you're having a vigorous response. Now, when it makes the child just miserable, then it's certainly fine to use ibuprofen or Tylenol. I would even say to use ibuprofen or Tylenol, even if there's no fever, if they're miserable. If the rash, if the sores in their mouth are very painful, then by all means help them with their pain. Now, there's not a lot you can put on the sores in the mouth. You could try to dab on a little bit of Maalox. That would be okay. In the diaper rash area, since it's not from a yeast infection, if you know they have hand, foot, mouth, really the only thing you can put on there is sort of a barrier ointment like Aquaphor or Desitin or Hfmd or one of those, just to keep it from being so painful. If there's an open sore and the urine or poop touches it, it could burn. So just a gentle ointment in that area would be fine. Same for any of the other lesions. Now, one thing you would be careful about is in trying to keep this hydration up, you want to avoid any kind of thing in the mouth that's going to be sharp, crackers and things like that, salty, chicken noodle soup, crunchy, acidic, like orange juice, anything that's going to burn or hurt in their mouth, they're going to refuse and it's going to cause worse pain. So instead, you could encourage yogurt, pudding, ice cream, applesauce, things that are soft and smooth and creamy that won't burn or hurt any of those little ulcers in there. Hope that makes sense, you guys, because we really need you to keep the child not in pain and keep them hydrated. Another common question we get is, do I need to take my child into the pediatrician's office to confirm that this is hand, foot, and mouth disease? Usually not. If you know it's going around and you know what it looks like, and perhaps your daycare provider said everyone at daycare has hand, foot, and mouth, then it's hand, foot, and mouth, and we can't fix it. We're not holding back on some miracle antibiotic that we could have sent in if only you had come in and been seen by the pediatrician. So we see patients all the time and they'll say, I am almost certain this is hand, foot, mouth because everybody in their daycare class has it. But they're drinking fluids fine and their temperature is responding to Tylenol or ibuprofen. Well, then, I mean, it doesn't hurt us and we're not mad, but you could have saved your copay. You know, I mean, it just really wasn't necessary to come in. Other than this advice I'm giving you, there's not really a lot that we can do for hand, foot, and mouth. The other very common question is, okay, I know my child has hand, foot, and mouth. He's got the sores and everything, but I'm controlling the fever. He's drinking fluids fine. Wet diapers are good. What now? When can they go back to school? Well, that is our commonly used answer, which is once the child has been fever-free for 24 hours with no use of ibuprofen or Tylenol, then they're okay to return. Now, I would add, obviously, they need to feel like returning to school or preschool. If you're still having to hand spoon them some pudding and applesauce just to keep them eating, they're not in any condition to return to school. So they should only return to preschool, daycare, regular school when they wouldn't require any additional or extra care by their caregivers than they usually do. Hopefully that makes sense. So hand, foot, and mouth, Coxsackie A16, very common, goes through entire classrooms at times, not comfortable, but certainly benign and self-limiting. I hope that answered a lot of the questions you guys have had and all made sense. Let me know if you have additional questions. Thanks.